What do you feel like women are most scared of when they come in for their first mammogram?
I think they're probably scared of the rumors itself. They're like, oh, well, this is my first one. I'm scared. I don't know what to do. I don't know what to expect. So we try to actually break it down for them in different steps. And I tell them most of the time, well, this is a machine. I said, I know it looks scary, but I'm about to tell you exactly how it works. And so I break it down, a few sentences, turn the machine and just show them the different things that a machine does, so they can be familiar with the noises. The rumors are just 1,000 times worse than the actual test. So
oh, absolutely.
Once you break it down, it makes it so much easier.
Good morning and welcome to Pulse Check. This morning we are here with Gabby from Mammo, and we're going to talk about some of the fears and misconceptions women have about getting mammograms. Good morning, Gabby.
Good morning.
How are you?
I'm good. Thank you for having me here. I'm so excited.
I know. Get more people on your schedule.
That's
once
right.
We talk about some of these fears.
Absolutely. We need to get them in.
Yes.
Yeah, get them taken care of.
Yes. So, Gabby, tell us just a little bit about yourself and what got you into this field.
So I went to school, right? I didn't know what I wanted to do whatsoever. Went to college and I'm like, okay, I'll do an associate's degree in science because I wanted it to be medical. And then I fell into radiology. And then I fell in love with it, of course, with the whole medical photography part of things. And then from there, I was like, okay, well, I want to do something a little bit more, in depth. So, I explored my options, and then I gave Mammo a try, and I fell in love with it. I fell in love with just the patient care side of things, working with women because they need that comfort and that care. And they're just so emotional when they go in. Sometimes, if you get nervous or anxiety and they're just like, oh, I'm so sorry. I can't stop talking. I'm just nervous, so you kind of want to just be able to be there for them, even just in that moment to be able to just calm them down.
Yeah. I think your team does a really great job at that.
Well,
I know when
thank
I
you.
went for my first mammogram, it was like, everybody's so kind. They wanted to be your friend and explain everything so thoroughly. And
absolutely,
that help takes the fear away.
Yes.
So
absolutely.
I think that's awesome.
Yes.
What do you feel like women are most scared of when they come in for their first mammogram?
I think they're probably scared of the rumors itself. As soon as they come in, they reach Karen, who does our registration for us. She's kind of does take care of them at that moment, get them registered and get them ready for us emotionally as well. Try to get them, kind of break them down, be like, you treat them as a friend. Hey, how was your day? Is there anything I can do for you, kind of thing, to kind of break the ice, the nervousness. So she kind of preps them. Yes, she preps them for us. And so that does kind of help whenever we do get the patient. And then, they either tell us verbally that they're anxious, or you can just tell with the body language also, if they're you could just tell in their eyes, if they're scared or if they're just kind of hesitant, to getting in there. But a lot of that is just the rumors. They're like, oh, well, this is my first one. I'm scared. I don't know what to do. I don't know what to expect. So we try to actually break it down for them in different steps. Okay, I'm going to ask you your name and your birthday. We're going to do a history in this room. You kind of have to break it down because this is new to them.
Yeah.
So they don't know what we do every day.
Right.
And so we introduce them, to the room, everything around them, what they're going to do, how they're going to change, if they do have any questions at that moment. And then the third part is once they actually get in the room, we let them get a visual of everything. And I tell them most of the time, well, this is a machine. I said, I know it looks scary, but I'm about to tell you exactly how it works. And so I break it down, a few sentences, turn the machine and just show them the different things that a machine does, like so they can be familiar with the noises.
Right.
And everything for the most part.
Right.
And that, the paddle that says that, it's going to squish the, my
Right.
breast so much. And I'm like, well, the rumors are just 1,000 times worse than the actual
Right.
test. So
Oh, absolutely.
once you break it down, it makes it so much easier for them. And, as long as you're like, you have that open communication with them the entire time that you're there,
Yep.
they do become comfortable with it. And, you kind of check up on them as you do the test, which it can take somewhere from 5 to 10 minutes, depending on how the patient is,
right,
their condition and everything.
I've joked with people, I'm like, it's like going to the spa. You're in and out.
Oh, absolutely.
They're so nice. They hold your hand the whole way.
Absolutely.
And it doesn't hurt.
Yes.
Like people say it does.
Right.
So you and your team do a really good job with that.
Well, thank you.
Yes.
Thank you.
Yes.
We appreciate it. We do our best.
Why are routine mammograms so important? Even for women without a family history of breast cancer, like when you hit 40, I think it's 40.
Yes.
Is it 40?
It's 40. From what I've known.
Yeah. Like historically it's been 40.
Right. It's been 40. Definitely start at 40 because, everything, your body changes, of course, over time.
Hormonal changes.
Hormonal, yes. And of course your breast tissue also changes over time. We have, of course, medical terms for it, but even if you are older, your breast tissue may not change like the average, person sometimes. So that has a lot to do with it. The breast tissue, as far as them or the patients associating it with pain. Now there are some people, even though they're not quite 40, that their mother has had breast cancer.
Right.
At age 30. So sometimes the doctors will be like, okay, we want you to go ahead and start taking these mammograms now, because you never know. Breast cancer does not, what's the word I'm looking for?
Discriminate?
Yes. It does not discriminate. So It doesn't matter if you're 25 or 87.
Exactly.
It will come.
And early detection is key.
Absolutely.
I mean, because people can beat breast cancer every day.
Yes, they
so
can.
If you catch it early,
and
I think the fear of the unknown with women is what scares them a lot.
Yes, absolutely.
Like, oh my gosh, are they going to find something? Well, honey, I'd rather you find it early than late.
Absolutely.
So
yes, and there's a lot of patients that will ask, well, are you able to read my exam? I was like, no, this is for the doctor, to read. But usually we will communicate with the patients via, letters and everything as well.
It's quick.
It's
the
quick.
Turnaround is really quick.
It's quick. It's within a week.
Yes.
If that, from the doctor actually dictating the report to getting the letters out.
Right.
To them receiving it. And I tell them, I said, well, if there is anything that does need to be done, somebody will reach out to you, whether it's the doctor's office or whether it's us with the letter. They'll be able to get you in quick so we can follow up with that care.
Right.
And of course, they're scared and they're like, well, I can't wait a week or something. And I'm like, well, no news is good news, girlfriend.
Exactly. Exactly.
So that does help them kind of keep them at ease after the fact. That they're anxious because of the results.
Right.
So, but no, age, it doesn't matter. It can pop up anytime. Even if nobody in your family has had it. It can come, and like you said, the earlier you catch it, the better.
Yep. And that's why it's so important to do self-breast exams.
Oh, absolutely. Oh, and that reminds me, we actually have like the shower cards that we offer downstairs for the ladies. If they want to, of course, put it on their shower.
Yeah, it's a good reminder.
Absolutely. And it's very important, if they do end up feeling something, whether they're in the shower or like per the instructions, if you need to lay down and kind of do a self-exam as well, to definitely get that taken care of and come on in, just in case. You never know.
Yeah. So let's talk a little bit about the technology we have at Carolina Pines. I know technology has come a long way over the years, especially over the past 10 years or so.
Absolutely.
For getting mammograms. Can you tell us what we have at Carolina Pines, like what machine we use?
Yes. So it's the GE Senographe Pristina. She is amazing. I just call her Pristina. She's amazing. She delivers a high image quality exams on the, of course, technology part of things, as well as the more comforting side for patients as well. So this one is a design made by women, designed
Oh,
for
wow.
women. And we always get a big eye opener when we tell our patients that. And so
Yeah.
they're like, oh, finally, you know, like a
Finally.
sigh of relief. Because, you know, you always think machines are man-made, and it kind of gives them a feeling about it. So,
and typically men aren't getting the mammograms. I know some do,
right,
but
some
typically
do.
not. The majority are for
Correct.
women.
The
so.
majority is women, for sure. So they the women come in, and then, you know, we kind of introduce, because Karen does kind of give that little push, be like, hey, you know, we got this machine and it's just so amazing, you know, just kind of does her little thing. And once they get in there and get the visual of it, you know, I'm able to tell them, all right, well, this is the part where it just delivers so much more image quality for the radiologist to read, as well as for your comfort. Because the part which we call the bucky, where the patient actually lays her breast on, it's supposed to warm up with their body or breast temperature.
Oh, wow.
Yes, within a matter of just seconds, which really, I was like, wow, mouth drop.
Yeah.
Did not know that. And so it does make a lot of the ladies a lot more comfortable, especially if they're cold natured. I mean, it's already cold in there.
I know.
Regardless. So that helps them a lot, especially to just be able to, okay, here we go. I trust you because I know this is what this machine can do. All right. So I actually brought this, what we call Pristina Dueta, which is this handheld device that assists patients that they can hold while they're doing their exam, to be able to compress themselves a little bit more.
Oh, wow.
So to take control.
Or like if it's pinching, they can release it a little bit.
Yeah, they can release it a little bit. So we'll still do art on our part, kind of get them situated, get in position like they're supposed to be. And then once we get them situated, we hand them the remote. And then at that point, of course, we instruct them or give them instructions before we start the exam. Right. So they're not like, okay, you know what's happening. And so it has two buttons on there, a plus sign and a subtraction sign.
Yeah.
And then, of course, you add more compression with the bigger button, which is the plus sign, and it actually compresses them more. So they just feel like they're in control, that they're like, okay, well, I'm in charge of this. So it helps get a better image, getting more compression on the breast, because it does reduce radiation as well, which is a plus because this machine also has the image quality in a low dose as well.
Yeah.
So whenever we go to actually take the picture and everything, I mean, you're getting a low dose of radiation overall.
Oh, really?
Yes.
Like what? How much lower than the traditional?
It's the same than the traditional.
Oh, yeah. Okay.
But it's just more, you know, it's more like advanced with the 3D technology and everything, and the way that the images are taken at that point.
Yeah, I think it's so cool that we have this machine here.
Oh, absolutely. And the patients love it. They've been trying it, and they're hesitant at first, because it's like, since this is the only machine that of the GE Senographe Pristina, you know, in the state of South Carolina, it just, you know, the patients are hesitant at first, but once they get the hang of it, they're like, oh, wow, I love it. Yeah. And it's shocking because, you know, you don't really hear about that around here. So like once you get to try it and feel for yourself, and it's like, oh yeah, I can do this. And it definitely reduces the anxiety and everything with patients as well, when they're able to take control. And statistically, it is also shown that women are able to tolerate more compression, actually being able to take control over their exam, because they feel like they're a part of it. Yeah. As well.
I think that's so important.
It really is.
Yep. Now we just need to get more women to make their appointments and not put it off.
Absolutely. Yes.
For someone who's listening to this podcast and is overdue for a mammogram, what are like the top 3 things you want them to hear today?
Let's see. I would say that just come on in. Just entrust us, you know, with your care, and let us show you, you know, what the misconceptions are versus what the reality actually is about it.
Like debunk those misconceptions.
Absolutely.
That
yes.
It's not as painful.
Right.
It does not take a long time.
Exactly.
So how far out, like if I was to call today to make an appointment, how far out would I be to get in?
I would say, let's see, what's today? Friday. I would say within the next week or so, if that.
That's awesome.
Yeah. I mean, there's usually openings, and, you know, depending on people's situations, they'll call and say or ask, like, what, you know, do y'all have any openings? And we look at their schedule, and then we kind of determine from there. And then they just, you know, ask for permission, and we thank them. Thank you for calling. Let us check for you real quick. And usually we can get them in.
So do you have to have a referral from a provider to get a mammogram, or can you call directly and schedule?
Yeah, you can call directly and schedule as long as you have a doctor that the results will go to in case you do have to follow up. That's very important.
Like a primary care or OBGYN.
Yes. Either or is fine. Now, some of the doctors will still send orders, which is fine, but it's not necessary. Not for a screening mammogram. Now, if you are having issues with your breast, you do need to see your doctor, and you do need to have an order for that, because that's a whole different process.
Like a diagnostic?
Yes, a diagnostic mammogram.
Okay, so that's when, like, you would do the ultrasound and all that stuff leading up to the mammogram.
Right. Yep. This is when we work hand in hand with ultrasound. And like I tell patients, because they also get confused because they just see, I guess, the test as a whole, or why am I coming back, you know, for more? Like, they always think that, where my image is not good enough. And it's not that. It's just that the doctor may have seen something, or possibly like, red flag. That doesn't mean there's something wrong. They just want to follow up with you. It's very common for them to do that with, of course, our patients, and not only our patients, but just those that have more what we call busy breast, you know, because, you know, this exam is mostly accurate. And of course, with our 3D technology, it does tell the difference between, for example, if you have a mole on the outside of your breast, the doctor knows it's outside on the skin, and they don't get confused as to, is this a mass versus a mole?
Right.
So they're able to see through the breast.
Yeah.
And like I tell patients too, I said, just think about it like slices of bread. That's how they can see your breast tissue. And so when you break it down for them and just openly communicate all these, you know, because it's just information they don't know.
Right.
You know, so once you tell them why we do the things that we do, following up to a diagnostic mammogram when they do have to come back, you know, you try to, of course, comfort them and give them the facts. You know, we're just doing this to follow up on that area. That doesn't mean there's anything wrong.
Right.
Because it can be breast tissue on top of each other.
Just take an extra precaution.
Right. Absolutely. And then ultrasound does help with that, because we go hand in hand. And like I tell the patients, you know, whatever we can't get in here, with the mammogram, ultrasound can sometimes see it. Like, they can see some things we can't, and then vice versa as well.
That's awesome.
So whenever we inform them, they feel better about it, and they don't feel like, why am I sitting here so long? What's happening? And so we explain that, and it's good after that.
Well, good. Yeah. But it's so awesome that we can offer this in Hartsville.
Oh, yes, absolutely.
And
you can
obviously not just to Hartsville, but to surrounding communities that travel here for their care.
Exactly.
Closer care to home. Thank you so much, Gabby, for being here.
Yes, ma'am. Thank you for having me. I appreciate it. I had a good time.
Yes. Hopefully we got some education out on mammograms and debunked some of the myths.
Absolutely. Yes.
Yep. Thank you.
Yes, ma'am. Thank you.
Thanks for listening to Pulse Check. If you enjoyed this episode, be sure to like, follow, subscribe, and share it with someone who might find it helpful. Your support helps this podcast reach more people in our community. Pulse Check is a production of Carolina Pines Regional Medical Center. Special thanks to our producers Hannah Cadell and Anna Tingen. Audio, video, and editing services by Seth and Grayson Johnson at Lockwood Studios. All content is for educational purposes only. We do not intend for the content to be a substitute for professional medical advice, counseling, diagnosis, or treatment. Our content doesn't engage visitors into a professional relationship. We'll see you on the next episode of Pulse Check.